Now that we are in the middle of a very busy interview season, we are getting a lot of questions about the themes or topics that can be asked during the interview. It comes as a surprise to many when they find out that the interviewers can do an in-depth discussion on your hobbies, which are listed on the CV. So first question, does it actually happen? Can you be asked to sing and dance? And the answer is yes. In fact, in this season, one student was asked to dance in an internal medicine interview, and another one of our students was asked by a program director in an OBGYN interview to sing. Both of these were mentioned as hobbies on the CV. So then the obvious question is why? Why would an interviewer want you to sing or dance as part of this interview? There are some reasons. First, they may genuinely want to know the non-medical side of your personality. Then some interviewers are just checking to see if you're bluffing or lying. Many students pad up their CVs and use filler hobbies, but these can be easily identified. The most important reason could be that the interviewer may share the same hobby. And that's where you can connect with the interviewer and turn that interview into a conversation. This could be hugely beneficial to you. You and the interviewer just found a common theme, and hopefully you are able to articulate well enough. You can be sure that you'll be rated very highly by the interviewer if that happens. Finally, and many students miss this, a hobby is cultivated over years. Sometimes the interviewer wants to see how much of the topic you have mastered. If you have a hobby, you would know a lot about it. So the discussion is to find the depth of your knowledge about the topic. If you've been doing something as a hobby for say 5 years and you have only superficial knowledge, the interviewer is probably beginning to doubt your claims of quote unquote the extensive clinical or research experience that you may be claiming on the CV. So just keep an eye out for that. A similar question, teach me something non-medical. Now they're trying to see if you can take anything non-medical, be it cooking, singing, and so on, break it down in a sequence of logical steps for someone who may not know anything about it and make him or her understand it. There is a reason for it. You will end up explaining a lot of medical and technical terms, conditions to your patients. So they're trying to see if you can actually do that. So while you won't be expected to actually swim or hike in an interview, read up enough on your hobbies to have an in-depth discussion or a couple of minutes of teaching session on your hobbies.